Once again, Dr. Alalade here at Ask the Gynecologist, and I'm happy to be hosting you tonight. If you're free, like always, join me and let's have a quick chat together. We are live on Facebook, we are live simultaneously on Instagram. I'm your host here, Dr. Babajide Alalade, and with me, by the grace of God, there is no dull moment. So, once again, if you're free, join me, let's have a talk together and I'll be hosting you today. Today is Tuesday. Sorry, I was testing you. Today is Wednesday, and March 10th, 2021. We are broadcasting simultaneously here on Instagram, and people are there already live, and we're on Facebook here today live. The topic of today is very, very interesting one. So stay tuned and be attentive, as I'm going to say this thing not twice, once. Okay, we've been shaking tables over the last 24 to 48 hours, and the tables are still standing. So we continue shaking tables and we continue getting things properly set. So once again, I want to say you're welcome here. If you're going to be on any group on Facebook as a lady, this is where you're supposed to be, on ATG. If you're going to be on any group on Facebook, this is where you're supposed to be, on Ask the Gynecologist. There's no other better group for you to be today on Facebook than here. And everybody's watching us from all the way as far as Ghana, Nigeria, America, Europe, which includes London, France, Estonia, even Russia, Israel, even Germany, far as Southern African countries, including Kenya, Mozambique, Botswana, and so on and so forth. And it's a blessing to be able to come across so many women and to change lives. My joy consistently is to add value to people's life, to change people's life positively. And that's what we do on ATG here. And by the grace of God, we will not fail. Once again, I want to introduce myself to you. My name is Dr. Babajide Alalade, one of your admins at Ask the Gynecologist. And for you to be here today, I'm so happy. I'm grateful. And the fact that you're spending your time, most importantly, your data, to listen, to watch, and to be part of this group is a blessing. And I'm so grateful. And I want to say thank you. Tonight, I'll be talking about miscarriages. I won't be able to follow answers on my phone because I'm using my other phone for Instagram as I'm talking. But if you have any questions tonight, put it on the screen. I'll trash them, I'll answer them for you as we work together. I know everybody has read our post on vagina farting, and people are saying, it's music, it's that and that. Yes, there's nothing wrong when a woman is farting from the vagina during sex. It happens most of the time during doggy position, because as you're pushing her in as the man, basically you are doing vulcanization. You are pushing air in. At some point, you have to, if you don't compress the air and push the air out, it will make the woman tummy uncomfortable. So if you want to avoid such sound, you can put pillow under the woman's tummy to reduce the inflow of air. But as you're doing doggy position, there'll be hair going in and to make the woman uncomfortable. So once in a while, after about 10 or 15 thrusts, compress the hair. You hear the hair come out. Continue again. Attack. Reggae. Don't dull the moment. Thank you so much. So today I'll be taking questions regarding miscarriages, questions regarding infertility, questions regarding ovulation. And if you have any questions for me on Instagram, ask me as well. We've been doing this simultaneous broadcast on Instagram as we do this live show, and for the last 2 or 3 days now, and it's been very, very effective, and people are benefiting immensely from the simultaneous live broadcast from Facebook here and on Instagram. Okay, and so it's been wonderful. So tonight is about miscarriages. If you have any questions regarding miscarriages, any questions about ovulation, let me know. Don't forget that this month we're going to have the ovulation seminar, and during the ovulation seminar this month, I'll be talking about what you should know about your ovulation. It's amazing and so sometimes heart-wrenching and heartbreaking when you talk to a lady and you tell them about their menstrual cycle, and some ladies don't even know what menstrual cycle is. I'm not saying that it's your fault. What I'm saying is that as far as you're an ATG, we want to ensure that there's a change in what you know. There's no benefit of you being here and you can't know what your menstrual cycle is. There's no benefit of you being here. You don't even know what day 1 or day 2 or day 3 is of your period. You've been told to go and do a day 3 and LH profile, and you don't even know what day 3 is. You don't even know what your fertile window is. You don't even know what your ovulation is. You don't even know what your period is supposed to be. It's sad. To avoid all these things, okay, we are going to trash these things. What regular period means, what you should see before expecting a period, the things that could go wrong with your regular period, and what you can feel in your body to suggest that you might have a regular period, what you can be having during your period that suggests that you have endometriosis, you have irritable bowel syndrome, which can happen during period. All these things are going detailed this month, March seminar. So if you've not registered for the seminar, please register. And to make it good for you, as you join the seminar, register for the seminar, this March month seminar, you're getting 3 PDFs for free. 3 PDFs. We always have PDF every month. You're going to get 3 PDFs for free. And if you make me happy, if everybody makes me happy, we're going to give you even all the PDFs of seminar we've done January and February. It costs us nothing to spread this knowledge. But if we don't put this small gate pass, we'll lose control of how we control the crowd. So that is the reason why we put this small control fee. And if you've noticed us, over the last 3-4 years, we've not increased any of our seminar prices. No. Despite the inflation, despite the economic hardship, despite the NSAS issues, we've not increased anything. There's a question coming up here on Instagram. Good evening, doctor. It's been over a year I delivered and my ovulation and period haven't started. Is it normal? It's not normal. But if you're breastfeeding hourly and on demand, it could delay your return of period. But a year, you should have probably start slowing down your breastfeeding and your period should be back. What you should do first things first, do your prolactin hormone and let's know what's going on. Another question here on Facebook, Christy Jack. Please, what can a woman whose period just stopped take? For about 6 months now, no period, age 42. First of all, we need to know why your period is not happening. Are you going through premature menopause? We need to do your FSH hormone because we need to know why you're not having a period, why it just stopped. Probably you're going through premature menopause. So we need to do your FSH hormone, day 21, FSH hormone and your LH hormone to know what's going on first of all before we start giving any medication, okay? So we don't do things blindly. Blessing Temitope is asking, what can someone with blocked tubes? Can someone with blocked tubes ovulate? Yes, your blocked tubes does not stop you from ovulating. Your blocked tubes does not stop you from ovulating. Blocked tubes does not stop you from ovulating. Only that the eggs will not be able to pass through the tube to get to the womb. So the eggs will be stuck and they will degenerate somewhere along the tube or in the ovary because they can't pass through. Okay? Doctor, is it normal for one to have a irregular period for 3 months after failed IUI? Yes, it can happen. After a failed IUI, because you might have been given some medications to stimulate your ovaries to release eggs. So if it fails, your period could be a bit irregular for the first 1 or 2 months. It's like when you have a miscarriage, your period could be a bit irregular for the first 2 to 3 months. So it can happen. It can happen. Thank you, Bumi Falana, for being here. Jane Dera, she's saying, is it normal? Okay, I've answered the question from Jane Dera. I've answered the question here on Instagram here. I've answered your question on Instagram from Uche Dorothy. Thank you, Uche. Thank you, Chidima. Okorafo, thank you so much for being here. Guys from watching from Instagram, I really appreciate you. Well, God bless you. So I got a question from Mary Amoloyede. If blocked tubes first stop ovulating, how can sperm go through? There's nothing called blocked tube ovulating, okay? If your tubes are blocked, okay, you will still ovulate. Just that the eggs cannot find their way into the womb cavity, that's all. Even if you have one tube removed and you have 2 ovaries left, whichever ovary you ovulate from, the tube that is left behind that is good has the power to go and pick up the eggs wherever it's being released from. So if you have your right tube taken away, you still have your left ovaries and your right ovary. If you ovulate from the right tube will pick up. If you ovulate from the left ovary, the right tube will go and pick it up there. So there's God that controls everything there. They know what to do and where to go, okay? Can you please give me a contact number or person in US? I don't know anybody in the United States, okay? I have no doctor that I know in America, okay? I'm in UK here, and I also work in Nigeria as well. How much is the registration for the seminar? It's $2,000. To register for the seminar is $2,000, and Gloria has already put the link for the seminar for March already on the screen, okay? Now, let's take more questions. Can someone see something? I don't know what the person is saying. Fabi Banti, what is the cause of not being pregnant after HSG? Maybe the tubes are blocked. The cause of not being pregnant after HSG is probably that your tubes are blocked, and we have to unblock the tubes. We can do ideal tubation to flush the tubes open, and if it doesn't work, then we have to do what? IVF. Someone is asking, what can you do to stop salivating during pregnancy? Use chewing gum. It help you, okay? Or sip tea that contains ginger. Doctor, that's from Linda Opoku Apia from Ghana. She's saying, currently you're expecting your O negative and your husband is O positive. So you've taken anti-D injection, but you didn't take it after your last childbirth. So you're scared. First of all, don't be scared. Don't be scared. Don't be scared at all. What you need to do now is that every two weeks, okay, always go and do baby's growth scan to ensure baby is growing well. And if baby is not growing well, we'll see on the scan and then we'll advise you. But you're okay. You've taken anti-D in this pregnancy, let it be. We will keep an eye on baby's growth, and if there's any issue, we take it from there. You can't change what has passed, so leave that past alone. Let's focus on the present today, okay? Very good. Doctor, can Candida albicans cause infertility? Can it block tubes? No. Candida albicans does not cause infertility. Candida albicans does not block tubes, okay? Please, apart from surgery, is there anything that can be taken to remove fibroid? Isn't 5 centimeter makes your period heavy and lumps of blood? If your fibroid is causing lumps of blood, making your period heavy, I suggest you take it out. That's honest truth. Now, if you don't want to take it out, you want to consider other options, there are 2 options you can do. You can use Mirena coil, but for your period to be very that heavy, Mirena coil might not even work to shrink or to reduce the bleeding from fibroid. If it works at all, it's going to be only a temporary measure. The other option would be for you to consider, okay, taking some medications which will stop your ovaries from ovulating. However, the drawback of that is that if you take some medication that will stop you from ovulating, you're probably not going to be able to get pregnant while you're on such medications. Those medications will switch off your ovaries. Another option is to what we do, we call the uterine artery embolization, which go and spot the blood vessel that feeds that fibroid and we block it off. But by doing that alone, the decision has already been made that you don't want to get pregnant anymore. We only do that option for people that don't want to get pregnant anymore. So for you to go for uterine artery embolization, you've decided that you're not trying to get pregnant anymore. Okay, otherwise we won't do that. If someone is asking a question, if you did HSG, you didn't get pregnant, what happened? Your tubes are blocked. That's what happened. Or probably you're not ovulating. Or probably your husband's sperm is not good. That's possibilities there, okay? What causes miscarriage, miscarriage, and what can be done? Miscarriage can be caused by maybe chromosomal abnormalities, sometimes infection in the womb, sometimes implantation failure, sometimes we don't even know why. Okay, but what we do is that if you have recurring miscarriages, 3 in a row for the same husband, then we have to do tests for you called thrombophilia screen. We do genetics tests as well for your husband to know why, or is there any possible reason why you're having these consistent recurring miscarriages. All right. Someone's asking, this Blessing B is saying, what can be done when large volume of fluid is seen in the left fallopian tube, even 6 weeks pregnancy? If you have large volume of tube collecting in your tube cavity, it's what we call hydrosalpinx. In most cases, it's usually from infection. We give antibiotics to shrink it and to treat the infection. Okay, that's it. If you're pregnant, we don't touch it. But if you're pregnant, 6 weeks pregnant, and we are seeing large volume of fluid in your tube, it could be a ectopic pregnancy as well. So we need to scan you again and get a second opinion to ensure that there's no ectopic pregnancy in that tube. Good evening, Mojisola Olarenwaju. Doctor, is it normal not to menstruate when an hormonal plant for a year? It can happen. Yes, it can happen. Doctor, is chewing of ginger to avoid spitting? Yeah, you can chew ginger, but I suggest you put it in hot water, help it to simmer in that hot water, and you can drink it. It's safe. It helps to reduce vomiting in pregnancy. Thank you guys for watching from Instagram. We will love you, and I really appreciate you. Okay, good evening, doctor. You have breast discharge. You've been told that you've done a prolactin test and it's normal, but you're scared that it will not stop on both breasts. If you've done prolactin test, it's normal, but your breast is still discharging, I suggest you get to see a breast doctor. But I also suggest that you get your prolactin done in a different lab, because sometimes people do lab tests and the results are not well reliable. So do another test for prolactin in a different lab entirely. If you don't know where to go to, you can fall into ATG Laboratories in Lagos mainland, and we'll do your test for you there. Okay, for your prolactin and any fertility test you have that you want to get done, scan included, get it done at ATG Laboratories, including your semen analysis for your husband. If the tubes are blocked and we've tried to flush them and it's not flushing, we have to go for IVF, because if the tubes are blocked, what it means is that if you ovulate, there's no way the eggs will find their way through your tubes to get into your womb cavity. In such a way, we have to bypass the tubes and do IVF for you. Okay. The commonest cause of IVF usually 3 things: sperm problem, blocked tubes, or ovulation failure. Okay. Right. I might have missed many questions. If I've missed your question, please forgive me. These things are very fast and they go very fast. Okay. Now, good evening, Kelechi Favor. Kachichuku Nkechi Cynthia. She's saying, no questions for today. Only send a big shout out. Thank you, Kachiku Nkechi Cynthia. I love you so much. Thank you for sending love to ATG, doctors, and all the admins. Yes, you rock too. You rock. Faith Ekara, she's saying she's also sipping tea. I'm sipping tea because it's a bit cold here in the United Kingdom. So it's a bit cold here. If you need center in Abuja, at ATG has only a center in Lagos, right? But we have doctors I can refer you to in Abuja that will look after you. We have doctors in Abuja that we can refer you to that will look after you. Okay, I've heard from my secretary that a lot of people have been inquiring at the ATG laboratories and find out when the IVF center will open. We're not yet open, but we finished construction. Okay, we're working on some field logistics and we're open to open by June, July. However, with things being in our favor, with the winds behind our sail, we might be able to even to open before then. But definitely, what you can do, you can call the ATG laboratory, you can call the manager, my secretary, Nike, on the number we've given here. Talk to her, and she'll take down your name. She'll take down your number. And once we open, you'll be the first person she will call. And to make it easier for people, we are making sure, and I'm working towards the fact that for everybody that comes to ATG laboratories, they get 2 IVF cycles for the price of 1, by the grace of God, so that people can get the opportunity to get pregnant easily, cheaply. And by the grace of God, the cost of IVF at that ATG laboratory will be cheaper than anywhere in Lagos. The reason is that we want to, obviously, it's not going to be free because I have to pay doctors and pay the cost of running the places. It can't be free. But I will ensure that profit is not our aim. The reason is that the center is built loan-free. We don't owe anybody. Instead of, we don't owe any bank, really. So, but we owe you to give you good service. Because we ATG owe you personally to give you this best service. We want to make sure that our purpose in this laboratory, IVF center, is not for profit. It is to change lives and to put smile on people's face. So I will ensure that people get any IVF they do, 2 for the price of 1, all through the existence, all through what the lab is there by the grace of God, unfailingly, by the grace of God, God behind me, God behind us. Okay, thank you. So let's take more questions here. If I've missed your question, please forgive me, because these things are moving fast, and you know I don't talk very fast. That's why. So I talk a bit. You know what I mean. So doctor, can itchy nipples and noisy stomach before period, is it normal? It can happen. Yes. Doris Onyinyechi is asking, how can PCOS, that is polycystic ovarian syndrome, how can it be treated? First things first, you have to lose weight. Even if you are leper, lose that 3 to 4 kilograms. It will make a change. You'll be shocked. Just that losing that weight, it makes your body respond much better, and it makes your body change, and it makes things better. Number 1. Number 2, we can give medications if you're diabetic. Number 3, we can consider surgery to destroy the polycystic ovaries on your ovaries. Okay, ATG is run here today by the grace of God. Okay, by the grace of God. Okay, thank you, Balogun Ige, for your question. God bless you. Doctor, what causes irregular menstruation? Usually irregular hormones, okay, or imbalanced hormones. Okay, thank you, Evangeline Imafidon. Doctor, what is the use of ovofolic? It's probably folic acid to boost, to give you a level, increase your folic acid level and to reduce neural tube defects in a baby. Folic acid is not to give you ovulation. Folic acid is not to make you get pregnant. Folic acid is to prevent neural tube defects in any pregnancy. Neural tube defects are malformation in the brain of the baby that can destroy baby. So folic acid is needed in the nerves to be, for the nerves to grow well and for the brain to grow well for the unborn baby. So it's usually very critical that you take your folic acid in the first 12 weeks of pregnancy to reduce the damage to the baby's brains. Okay? Very good. Mbelu Lillian Amarachi Oji, you read my post on mastitis. Does it mean that breast pump is best option? No, I didn't say so. But it's one of the, if you're having mastitis, okay, in life, everything must keep flowing. So if you're having mastitis, you should keep lactating, okay? If you cannot feed the baby, you can use the breast pump to keep the flow. By not lactating and stopping the flow, because I say, I have mastitis, I won't breastfeed. You're making the breast engorged. One, that will cause pain. If the breast is engorged, even without breastfeeding, it will cause pain. It will be heavy. If you go to the dairy farms and you don't make the cow for one day, that cow will be in pain. The same thing too for a breastfeeding mom. Even if you don't have mastitis and you don't breastfeed regularly to expel the breast, it will be engorged. It will cause pain. One. Two, if someone has now infection in the breast area and the person is not lactating, not allowing the breast milk to flow freely, it will cause more problems and it make the infection propagate more. So even if you have mastitis, take some painkillers, antibiotics as necessary, usually fluoxetine. Keep breastfeeding. If you can't breastfeed, use breast pump. All right? What does slippery period mean? I don't know what it means, honestly. So make it clearer for me. I don't know what slippery period means. Doctor, what is staph infection? Staph infection is nothing for you to worry about. One, it doesn't cause infertility. Two, it doesn't cause blocked tubes. Three, it doesn't cause irregular period. But Staphylococcus bacteria, it lives on the skin of normal human beings, okay? So usually, whenever we're trying to collect your swabs from vagina or your semen, if that swab does contact any hair on your body around your vagina area, it will grow Staph aureus. It doesn't mean you have any problem. It just means that it's a contaminant, okay? Nothing to worry about, okay? Best fact. So someone is asking a question about ovary. We don't have any doctor ATG in ovary, but we have affiliate doctors to ATG in ovary, and I can refer you there. If you need a referral for that, just send an email to the ATG 2018 email services at Gmail, ATG services 2018 at Gmail, and someone will attend to you there as soon as possible without delay, okay? How long is it advisable to wait before trying after removing fibroid? Give it 3 to 6 months. I'll say 6 months. Wait before you try to conceive after fibroid removal. Okay? Very good. Doctor, where is ATG Lab in Lagos? You are asking for the address of ATG Lab in Lagos. So please, any of our team members there, moderators, please give this wonderful lady the address of the ATG Lab in Lagos. Ajayi Adekola she's asking for the address of the ATG laboratories in Lagos. So Nike, if you are there, Gloria, Lily, any of Shadi Gomez, any of our team members, please give Omowonuola Ajayi Adekola the address of ATG laboratories in Lagos, please. Thank you. Okay, let's take this question here. Okay, Eniola Sheung is also asking. Okay, sorry, Miriam Oloyede is asking as well for the address of the ATG laboratories in Lagos. So give them the addresses as soon as possible, please, guys. Thank you. How long do you have to take? Do you have to wait something? How long does it take to take in after contraceptive like Levofem for a year? As soon as you stop the contraceptive, within 3 months you can take in with having regular intercourse. Somebody is asking for ATG office and ATG laboratory in Lagos. That's Tricia Jesus. So if our team members are there, please put the address of the ATG laboratories for these wonderful ladies. They need to get tested as soon as possible. Same thing to Ramatu Bantam. Mandeline Edidiame. She's asking, what causes a woman to have all the signs of pregnancy without period? Exactly 3 months period comes. It's like, obviously it's not pregnancy. It's probably hormonal imbalance, definitely. So, or probably you have irritable bowel syndrome, making your tummy bloated. All right. Sorry, I've been ignoring you on Instagram here. If you have any questions on Instagram, I'm with you now. Put the questions up. Let me answer now, okay? Thank you. Who is here? Doris who is asking, when do you try for a child after fibroid surgery? Give it 3 to 6 months. I suggest 6 months to allow the wound in your womb, to allow the wound on your womb to heal before you start trying for pregnancy. Doctor, what's the cause of sleepy period? I don't know what you mean by sleepy period. Basically, probably what you mean is that you're seeing mucus discharge. It's normal. It's normal. As far as there's no offensive discharge, it's not itchy. It's okay. Good evening, Doctor Uyiwa. Can someone who gave birth through cesarean section get pregnant after a year? Yes. If you had C-section, give yourself 12 months. But there's no rule, there's no guideline on that. But I would say give yourself minimum of 6 months. If you can give 12 years before trying, better. 12 years before trying to get pregnant after a C-section. Doctor, okay, I've answered that question for Alalade. Wilson Joe is asking, what is the cause of something, of seeing ovulation mucus? Stop showing. You don't have, I've said it again, you don't have to see mucus discharge to suggest that you're ovulating or not. Okay? If you think you're not ovulating, then go and do day 21 progesterone. That's all. And then we take it from there. There's no guesswork in life. I don't like guesswork. I go by facts so that we can know benchmarks. Okay? From Instagram, a 15-year-old daughter doesn't see her flow regularly. Concern? No. In the first few years of life of a woman's period, usually from age 12 to age 15, 16, the periods are very irregular. They could be regular for about 2-3 cycles, then irregular again. Then afterwards, from around age 18 onwards to around age 45, the period become regular. Then as soon as a woman is crossing 45 towards age 55, it starts to become irregular too. And then period stops. So at the ends of a woman's reproductive life, at the two ends, very young, very old, also very young on getting a bit older, your periods are irregular. In between, they are regular. So it's like you're trying to start a car. You want to change the gear, the car is jacking. And then you try to park the car too. For an unexperienced driver too, the car is jacking. But as far as the car is moving from 2 to 3, 3 to 4 gear, 3 to 3, is smooth sailing. The same thing too with a woman too. The first few years of life, of reproductive life, the periods are a bit irregular. Then later on, they become very, very regular. Then towards the end of the reproductive life, it becomes irregular too. It's okay. Don't start pumping the girl with medication and start disturbing her hormonal balance so that she doesn't lose power to concentrate and focus in school. Okay? Doctor, what can cause a woman to have period to cease for 3 months now and she's not pregnant? Maybe she's gone through primary ovarian failure. What you need to do hormone profile. Simple. Prolactin, FSH, LH, and let's know what's going on with the woman, okay? That's it. After 10 days of progesterone, no period for 20 days, what's the solution? Okay, solution would be to know your hormone profile. Why were you on 10 days of progesterone in the first instance? What was not normal? Was it your progesterone? Was it your FSH? Was it your prolactin? Was it a combination? So we need to know what was not wrong, was not right, and we fix it. Doctor, is it possible to have candidiasis without itching? It's possible, but sometimes candidiasis can be so bad, all your skin down below is so raw and painful. Doctor, you stopped breastfeeding for over a year and milk is still coming out of your breast, but still you return for a while, blah, blah, blah. You've taken bromocriptine, but it doesn't work. So we need to get you to see the endocrinologist to scan your brain to see and check a small organ called anterior pituitary to see if there's any prolactinoma or any structure causing issues there. Yes, or probably we need to check your prolactin in a different laboratory. Yeah, so we need to basically refer you to endocrinologist. If you have persistent high level of prolactin, we need to do and get you to see the endocrinologist to know why your hormone. Endocrinologists, they manage hormonal imbalances. If it becomes critical, if it becomes stubborn, if it becomes difficult to control, and they get you fixed up on time. Doctor, you spotted for 2 days from the day predicted to be your first day. It's 2 weeks now. You haven't seen any blood flow. Is it normal? No, it's not normal. It could be polyp, it could be fibroid, it could be infection. So get examined, ultrasound scan, and then we take it from there, okay? Doctor, can IVF be successful? So if you have, so this lady asks idiosalpinx. She's asking, can IVF be successful with hydrosalpinx in place? Is very, very unlikely. Gloria, I can see the Gloria, please, can you hear me put the address of the laboratory? We have a lot of ladies here, about 4 or 5 of them, asking for ATG lab address. So please, Gloria, help me put the address of the ATG laboratories now on the screen, please. Please, let me put it now. These 4 ladies have asking to get the address of the laboratory. So put the address of ATG laboratories for this wonderful lady. She needs to go there tomorrow as soon as possible to get all her investigations done without delay. So please put the address on the screen. Thank you. How many hormone profile in ATG laboratories? We do all the hormone profile, all of them, including including AMH, FSH, LH, D21 progesterone, prolactin, testosterone, rubella, VDRL, everything, including your scan, husband sperm count, your urine test, vaginal swab, even your pap smear, cervical smear to check that there's no abnormality on your cervix. We do all these things at the ATG laboratories. And in fact, we're getting set to start IVF there. So if you need IVF or you want to inquire about the IVF, you can call the lab manager and she'll take your numbers down. And as soon as we start, we'll call you first of all to know. And like I said again at the beginning of this page, I said we will ensure for everybody, because we'll go for a long time, that you get 2 IVF cycles trials for the price of 1 at the ATG laboratories. Thank you so much for joining us today. I need to go now. I hope to see you soon again tomorrow to talk more and more detail. Please, Gloria, thank you so much for posting the address of the ATG laboratories. God bless you. And thank you guys for joining us on Instagram. I love you so much. I love you so much over here on Facebook too. God bless you and see you soon. Have a wonderful weekend. Have a wonderful day. Have a wonderful weekend in advance. Thank you.